This is an instructional video on how to insert an IV. The first thing you need to do is assemble your equipment. Most units have an IV start kit, and these are some of the items that you'll find in there. The tourniquet, tape, the tegaderm, your cleanser, and a gauze. You'll also have to select the appropriate IV for the therapy or the diagnostic test that you're doing. And you'll have to have flush with some kind of connector device such as this J-loop or the short clave. Once you have all your equipment ready, you should wash your hands and prepare it for your insertion. You should introduce yourself to your patient and let them know what you're doing. You should also ask them if what you're doing is okay with them. At this time, you should assess if they have any forbidden extremities, and then conditions that may cause someone to have a forbidden extremity are a dialysis access, a patient who's had a mastectomy, a patient who has currently a DVT or a blood clot in that extremity. If they do report this to you, you should then place a pink armband on them. This alerts all staff that we're not allowed to use that arm for any blood draws or IV sticks or blood pressures. The next step in this process is to don your gloves and then search for your IV site. It is recommended that you always start distally in the hand and work your way up. So you should apply your tourniquet to the mid forearm if you're going to use the hand as your insertion site, or above the elbow if you're going to look higher in the arm. You should not place your tourniquet over a joint. As you'll see in this demonstration, how to apply the tourniquet. The tourniquet should not be too tight and it should not be too loose. If it's too tight, it causes excessive pain to the patient and the veins may actually constrict. And it may actually be more painful for the patient when you insert the IV. So as you can see in this patient's hand, there's several sites that are possible for this insertion. Your IV catheter should never be longer or protrude past the vein, such as being demonstrated right now. The vein should be as straight. It should feel firm and bouncy when you touch it. And you should avoid any area that looks infected or any area that has lumps or bumps or look knobby, such as where he's pointing right now. Once you determine the best site for your IV, release your tourniquet, get your equipment ready, and then prepare your patient for the insertion. So once your equipment is all ready, you're going to reapply your tourniquet. You're going to cleanse your site. You should do more than a swipe. You should cleanse it thoroughly and allow it to dry, as is being demonstrated. You should then prepare your patient and let them know what you're going to do before you insert the needle. As you can see, your angle should be about 15 degrees, and you'll have a flash of blood as you'll see filling the chamber. You can then advance your catheter forward, and while you're advancing the catheter, pull back on the needle, pulling it out of the arm. As you notice, there was a lot of blood return here, and one way to stop that is to hold pressure above the IV catheter in that vein. You want to occlude the vein and not the catheter. Then you'll pull back on your syringe while loosening and removing your tourniquet, and then you'll flush to make sure that the line is patent and in that vein. There should be no swelling or pain or any discomfort to the patient. You should then secure the IV to the patient's arm with the Tegaderm that's supplied in your IV start kit, ensuring that you have a good fit and a good seal to the skin. You should then use your tape to secure the IV better to the skin. With this IV in the antecubital space or the bend of the arm, it is often easy for these to come undone, so you should make sure that they're secure. Once you have your IV secured to the patient, you should flush and draw back one more time to ensure that the line is still patent. And then you are finished. Once you are finished, you should discard all your trash. You should put your used IV catheter in a sharps container. You should then remove the tourniquet from the arm completely. And then you will document the IV site. With the tab provided on your Tegaderm, with your initials and the date. This will then be documented in the electronic health record. And that is how you successfully started an IV catheter.